Hello everyone, welcome and Ahlan wa Sahlan. Thank you for joining us for Around the World in different time zones. My name is Irini Albanti and I'm the Executive Director at Harvard Humanitarian Initiative, HHI. I'm excited to welcome you to our Social Impact in Humanitarianism webinar series. I will tell you a little bit about the webinar series and then about today's talk and our distinguished guests. I designed this new series to address pressing issues in the humanitarian field and explore how humanitarian efforts create social impact for communities in crisis. One of the strategic goals of the series is to highlight the power of cross-sector partnerships as a catalyst for social change globally, how we in the academic, medical, humanitarian setting can work with partners in other industries, such as technology, the arts, business, private philanthropy, to improve the lives of communities in war, conflict, and natural disasters, and inspire action. How innovative collaborations, like the one today's panel will address, can raise awareness about critical global issues and offer different perspectives on how we tackle global issues. The webinar series brings together purpose-driven leaders who present their joint initiatives and talk to us about their commitment to reducing global inequities and impacting change for people in humanitarian crisis through their lens. Today, we have three exciting speakers who will tell us how Sesame Workshop, International Rescue Committee, IRC, and Level for Change, MacArthur Foundation, are partnering to give millions of children in Syria, Jordan, Lebanon, and Iraq the support they need to learn, grow, and thrive. The name of the program is Ahlan Simsim, meaning welcome sesame in Arabic. It not only reflects the welcoming and inclusive spirit of the program, but also the goals to restore hope and opportunity to a generation of children. I will briefly introduce our distinguished guests and then start the discussion. First, it's my honor to introduce Marianne Stone. Marianne has been working with the IRC since 2012 and in the Middle East since 2014. She's currently the Regional Project Director of the Ahlan Simsim program, which aims to reach children and their caregivers with high-quality early childhood development content in Jordan, Lebanon, Iraq, and Syria. Previously, Marianne held the position of Head of Programs in Lebanon and Iraq, where she oversaw the implementation of 33 million portfolios with programming in diverse sectors, such as protection, education, economic well-being, child protection, women's protection, and health. Before working with the IRC, Marianne worked in the US with a focus on social protection issues. Notably, she worked on raising awareness in issues of intimate partner violence within refugee communities in Houston, and served as an advocate for women's issues. Welcome, Marianne. It is my pleasure to introduce our second panelist, Renee Selaya. Renee is the Managing Director of Ahlan Simsim at Sesame Workshop, the program that provides early childhood development opportunities and support to families affected by the Syrian conflict and crisis across the Middle East, North Africa region. For almost 20 years, Renee has been a leader in international humanitarian and development strategy and practice. Growing up in Mexico and the US shaped his lifelong commitment to addressing inequality and injustice. He has worked in various country and regional positions with CARE International in Eastern Europe, Latin America, Africa, and the Middle East. He has also worked as an independent consultant on organizational strategy and performance assessment and as an assistant dean with the School for International and Public Affairs at Columbia University. Welcome and bienvenido, René. Our third panelist is Dr. Kristen Molyneux, Vice President of Social Impact and a founding member of Lever for Change, an affiliate of the MacArthur Foundation. She oversees multiple facets of competition and post-competition processes designed to unlock significant capital and help organizations realize their vision. In this role, Kristen manages key aspects of Lever for Change's competitions, learning agenda, and the Bold Solutions Network. Kristen also oversees MacArthur's Foundation $100 million investment in the joint program we are highlighting today with Sesame Workshop and IRC. Kristen was previously the Senior Program Officer for MacArthur Foundation 100 and Change Initiative, a competition for a single $100 million grant to help solve the critical problem of our time. In this role, Kristen co-developed, designed, and launched the inaugural 100 and Change competition. Welcome, Kristen. I would like to thank all three guest speakers for their time and sharing their experiences with us. Also to thank their offices and Sabrina Sarli from Harvard Humanitarian Initiative for helping us coordinate this webinar. A little bit about the format of the 1 hour talk. I will spend the next 25-30 minutes addressing questions to the panelists, and then we will take questions from the audience for another 15 minutes. We will conclude at 12 p.m. Boston time. You may type your questions in the Q&A function of Zoom, and we will do our best to cover most of the questions. So I will start a little bit about the Ahlan Simsim program. What is Ahlan Simsim? What is this program? And how come all three of you came together from different organizations? Sesame Workshop, Level for Change, MacArthur Foundation, and IRC. What was the inspiration and goals of these innovative partnerships? And maybe you can tell us more about the concept of learning through play. I will start with Marianne to learn more about the need, to tell us a little bit about the current situation of children in crisis. We have at least 70 million or more people displaced, half of them are children. And according to recent data from UNICEF, 102 million live in 14 countries that have kept their schools fully or partially closed for at least half of the COVID-19 pandemic, locking many school children out of any kind of education. So Marianne, tell us a little bit about the need that this program is addressing.
Sure, and thanks. I'm super excited to be here. And with Kristen and Renee. So yeah, so as you were saying, there's over 70 million children in these different crisis contexts. And one of the main things that this project is trying to address is the effect that stress has on children as well as caregivers. So I think we can all think about a day when our brain was overloaded with stress and how that impacts our ability to make decisions, and for children in particular, impacts their ability to learn and to thrive. And that's really at the core of Ahlan Simsim. We've seen recently, as you were saying, some of the data around COVID and how that's impacting children and their families in particular. So through the program, we did a small study last year in Lebanon that was looking at what is the impact of COVID having in a context like Lebanon, where we have not only the impact of COVID, but also economic instability and political crisis. And what we've seen is consistently caregivers saying that their well-being is suffering. And as a caregiver, if your well-being suffers, then the well-being of your child is correspondingly suffering with you. And we're seeing that children are being kept from school. Schools are either not able to open or there are access issues. So we're seeing that the effect on a children's daily life, on their routine, on their ability to go outside, on their ability to play, has really been impacted across the board in region. And all of these things are what we're aiming to work on, bringing hope and joy into families' life with the program.
Great, thank you. And Renee, you have a very colorful background on your screen. And I think I see Basma, Zad, and Mazuza, which is probably Kristen's favorite. Can you tell us a little bit about who they are and what specific needs in early childhood development they're addressing, and how are they helping children? Renee, I believe you're still muted. Sorry for interrupting.
Of course, one of us had to do it. I sacrificed myself. I think I'm going to answer just a little bit of your first question, because I think it's important to figure out how does Sesame's contribution fit into this bigger challenge that Marianne has described. And Sesame's mission has always been to help children go smarter, stronger, and kinder, and focused on supporting vulnerable children in different contexts, so originally in the US, but in MENA for over 40 years as well. And so why Sesame, why now, and how? And so the why Sesame, why now is that we identified the serious need of children, displaced families and host families as a result of the Syrian conflict and other conflicts across the region, as Marianne described, and we needed to do something. We wanted to do something. We found a willing and strong partner in IRC, and we committed to doing this work even before there was a MacArthur competition. We really wanted to contribute and experiment. What can we do? So we did a pilot together, and that helped inform what would later become our proposal for MacArthur, the 100 and Change competition. So I just wanted to share that very important origin story, as you mentioned, the story of collaboration. We collaborated around a commitment and a theme, and not necessarily a proposal. And I think that's really important for us to keep in mind. And so what is Ahlan Simsim? Ahlan Simsim is a promise we've made to families in the Middle East to create learning opportunities for children. It's this wonderful collaboration of different capacities and knowledge sets of Sesame and IRC in particular. And also it is a show. It is an educational resource that Sesame has created, a new Sesame for a new generation in MENA. And in order to do that, we created 3 new characters. Basma, a purple Muppet who is almost 6 years old. She's very enthusiastic and energetic and jumps first and asks questions later. Jad, who is a little bit more of a planner and likes to think things through before leaping. And then Mazuza, who is of course the neighborhood goat, as we all have our neighborhood goat. And they tell stories, they go through experiences that help children understand what they're feeling and also how to manage, identify and then manage those feelings. I'll pause there, I can go on, but I'll pause there.
Thank you. It's a pleasure to meet all 3 of them. So Kristen, this was a transformative investment in early childhood development in a humanitarian setting and planning for children's future and educating the next generation. What was the driver behind this one-time catalytic investment decision model?
Great. Thank you very much, and also happy to be here today. So yes, as you said, this was initially built as a $100 million grant competition with the goal specifically of solving a critical problem of our time, or taking a big chunk of a problem and solving it for a critical problem of our time. MacArthur has always strives to have transformational impact in the work that we do, but we also realize that a lot of grant-making institutions and foundations are kind of a black box. Program officers and staff go off and set an agenda and set a strategy, and then they go out and look for organizations that are working in those fields and who can help them kind of achieve the strategy that they've created. And a lot of organizations don't know how to get funding from foundations unless they specifically know a program officer, and it's really a complicated way of funding to a certain degree. And so we really wanted to change that model and kind of turn it on its head and provide an opportunity for organizations to tell us what they thought the most critical problems of our time are and what those solutions were. So rather than us setting the agenda, setting the problem, setting the solution, we really wanted to hear from the larger field. What are some of the biggest problems of our time? We ended up receiving over 1,900 proposals in the first 100 and change round that Sesame and IRC were part of. And ultimately, the board made the decision to provide the grant to Sesame and IRC. And I think a lot of that was because this was a moment in time where we could really shine a light on a very critical problem that was underrepresented and getting hardly any funding at all. So I think at the time of the initial grant, which was in 2017, 2018, early 2018, less than 2% of humanitarian funding was going to education, and only a very small fraction of that, I think it was 0.02 or 0.01% of that funding went to early childhood development. And as we know, children need early childhood development. They in order for them to grow into functioning adults that can be happy, resilient, and thrive, they really need that support at these early years. But there was very little funding going into that. Most of the education funding goes into primary schooling, and so if the kids are below that age, they're just not getting support. So this was really an opportunity for MacArthur to shine a spotlight on this really under-resourced area, and to choose two organizations who both had great reputations, knew the work that they were doing, had evidence that showed that their various models were effective, but bring those two partners together to see whether or not they could even have larger impact while working together. So that was kind of the impetus of both the challenge as well as the selection of Sesame IRC for this particular $100 million award.
Great, thank you. And you all talked a little bit about the collaboration and the joint collaboration. And in addition to collaborating among yourselves, you had to reach out to various local actors, government stakeholders to make this happen. So the power of collaboration across sectors is the primary goal of this webinar series. And I wanted to ask you how you built this relationship, how you connected with stakeholders from governments to national TV broadcasters while planning and scaling up Ahlan Simsim. Maybe start with Renee.
And you're very right to point out that while this is an interesting collaboration, this is not enough. We need others to join the effort to call attention to the needs of children in conflict and crisis and to support in their different ways. And that includes different donors, different implementing partners, national, international, of course, national partners that Marianne would be better to describe, and distribution partners, like you mentioned, broadcasters and research partners. And, so it's a whole range of different types of skill sets that we're bringing together to address, to call attention to the need and address the need now and into the future and for the longer term. In terms of I'll be brief on the broadcaster distribution. We are working with one of the regional broadcasters, and through which we can reach most children across the Middle East, not just the 4 priority countries of Iraq, Jordan, Lebanon, and Syria, but really children across the entire Middle East. And we've been fortunate that through them, we've been able to reach to date 5.2 million children in those 4 priority countries and 12 million more across the rest of the region through our Ahlan Simsim broadcast. And also through national broadcasters, about 2 in each country. And it's just an amazing milestone that we've come to at this stage, and we'll continue to broadcast more seasons and reach more children.
Thank you. Marianne, from your side?
Yeah, I mean, I think as Renee was saying, and as you were saying, partnership is really at the core of the project. In region, I think the testament to our success is that we really approach partnership with humility first. So we're not coming to this thinking that we have all of the answers. We're coming with specific resources and lots of inspiration and fun, but we certainly don't have all of the answers. We don't have all of the answers for the places that we work. In fact, in many places, we're really relying on partners like local government, line ministries, local organizations to create this network of individuals and institutions and organizations that are committed to the same cause and committed to trying to understand how we can improve the quality of early learning and the quality of what a child goes through from when they're born to when they're 8. An example I think that's interesting is that we've been working in Northwest Syria, and in Northwest Syria, the context is a little bit different from where we are in Jordan, Lebanon, and Iraq. And there, one of the really exciting things that the team has done is created a network. Right now, we're 12, I think, of local actors who are committed to ECD, and they come with their own ideas, and we're really creating this locally driven, almost like a movement for children in region. And we have different examples of this in all of the different countries, but this networked approach that we have and really coming to the challenge with humility, I think has really been key in what we're doing here.
Thank you. And Kristen, perhaps from the point of the foundation?
Yeah, I think collaboration and partnership is always critically important. I think from the very beginning, we knew that we were making a one-time $100 million grant. And so to Marianne's point about being humble, we don't have an early childhood development program. We don't have a humanitarian response program at the foundation. We have this one particular grant. And so we have really allowed the team to lead this partnership. And what we've been doing is trying to, on the backside, really work with other foundations and partners and bring other donors to the table to continue to support this work after MacArthur has left. And I think one of the things that's led to is the Lego Foundation also provided additional funding to Sesame to both support this work as well as support additional work in the Rohingya humanitarian response region. And that's been very exciting. There's been other donors who have stepped up and provided additional resources for certain aspects of Ahlan Simsim to just take it further, take it to the next level, do additional research, et cetera. So there has been some movement around that, but we are very humble and recognizing we can't do it alone as MacArthur. We need other donors and other people to come along with us. But I think one of the other really critical things that we've learned along the way, and I think Marianne and Renee can probably speak more eloquently to this, but the fact that MacArthur gave a large grant that allowed the organizations to staff up, to hire people, but also provided a 5 to 6 year long runway at the outset, really has been transformational, maybe maybe transformational is too strong a word, but I think it provides a different kind of opportunity for partnership on the ground. Because unlike a 2 to 3 year grant cycle like you might see with some funding, this is really given the team the kind of runway to form those partnerships, to be agile, to learn, to pivot. And I think for partners on the ground to see this project isn't just going away, right? It's not going to dissolve. There is meat behind the project, and it has legs. And I think that has provided different types of opportunity for partnerships that a regular 2 to 3 year grant cycle doesn't provide.
That's a great point, and probably a departure from, as you said, the typical funding mechanism where you have 1 month to submit a proposal that lasts 18 months. So how sustainable can the outcomes be? And so we talked a little bit about partnership, and I wanted to tell us a little bit more about the challenges to launch the program and perhaps some lessons learned. So if you were to scale it up to 4 or 5 more priority countries, what would be those lessons? And or how have some global events, in the beginning we mentioned about COVID-19, that many schools had to close, or perhaps the recent crisis in Afghanistan, how have these global events impacted the program and the communities you serve? Marianne, maybe we can start with you.
Sure. I mean, I think speaking to Kristen's point, just the agility that we were given at the beginning. So in terms of challenges with the way that we started, we were given a period of time where we could really step back and ask ourselves around the assumptions that we made when we did the design of the program. So our startup was also an inception phase. It allowed us to revisit all of the ideas and the things that we had decided or put forward to do and ask ourselves, is this still relevant? How are we going to move this forward? How are we going to do this? So I think that agility and flexibility really was key in our successful start. I'll let Renee speak to some of the interesting challenges around, working across a region and how that manifests with the show in particular, because I think that's very interesting for people to hear. But in terms of what we've learned and what we would do if we were thinking about scaling to other countries, which hopefully we will one day, I think the local context has been key from the start, and that manifests in the way that we approach content. It manifests in the way that we approach how we're working, and that has changed a lot because of COVID. So, what was the context 2 years ago is very different now, and we've been able to be agile and adjust to that, from the programming and how we do it over the phone versus in person versus over WhatsApp. Also the way that we collect data and how we learn and how we are able to iterate on those sorts of things as well. And I think that linking that all back to what works for the local context and allowing clients and partners to guide us in that has been the key learning. So in any new country, I think we would, instinctively lead with that. And that would, I think, set us up for success moving forward.
Renee, what about you?
In terms of the challenges, and I'll refer to those that Marianne mentioned, there are different challenges that as a program we're experiencing, and they are some context challenges, whether they are the instability in different geographies, and of course, COVID, Marianne described some of the impact on schooling and that the world experienced. So we also experienced that and are learning from it. And I think the other pieces of the practical stuff is we're creating stories that are supposed to connect with children. And how does one create a story where you're trying to reach a whole region, not just one country, and a region where a language varies so much across country to country and even within countries? And so we did a lot of reflection, a lot of it, the Sesame process that I can get into in a little bit, begins with the needs assessment of what do children need. And one of the priority areas was, of course, social emotional learning was the priority that our local advisors indicated. And then as it is social emotional learning, the language that you use to connect with children and for them to understand what you are saying needs to be a language that is close to what they speak at home. Because many of these children have not yet gone to school to learn the formal standard Arabic of the region. they're learning their language at home. And so choosing to lean into that dimension, to choose a language and a vocabulary that is closer to home rather than the formal regional language was a bold choice, a challenging choice. Advisors agreed, some advisors agreed, and some advisors disagreed with us in terms of that language choice. And so that was one of the interesting dimensions about how do you create stories and use an opportunity to teach children, but even the language choice is complicated. So I'll pause there.
Thank you. And I will probably follow up on what both of you mentioned, probably about this connection to listening to the community, the kids, their caregivers, going with the local context. And from what I have read about your work is that it was both evidence-based and also inclusive and child-centered. So the design approach and the implementation approach that you followed really centered it around the kids and the kids' need. And I know that, as you mentioned, you had advisors, you conducted formative research, you looked for what works in the local settings. Sometimes in the humanitarian field or global health or development, we see programs designed without this data-driven approach and without the beneficiaries' input on the actual needs in mind. And this obviously is not the case with Ahlan Simsim. And in the beginning, when you introduced the puppets, it's so great to see the local aspect that you didn't just transfer existing puppets, you really looked into what makes sense, translated the need locally, and also to focus on learning and research. So Renee, you mentioned a little bit, you talked a little bit about this thoughtful and meaningful approach to storytelling. And I was wondering if you can tell us a little bit more about the conceptualization stage, the content creation, and then the production stage, and what keeps you grounded to the needs of the children.
The Sesame workshop is been, something that we have been practicing. I'm new to Sesame, so to speak, only the last 3 years, so I sometimes say they. But it's something that Sesame has been practicing from the beginning, and it's very much research-based and whole child curriculum focused and the needs of the child. So that needs assessment is the first step. And the needs assessment is not just a survey that is done from external, it's a participatory approach where we listen to local families and advisors, local advisors, and that informs the educational goals of what you're trying to achieve. And then you bring in the educators to say, okay, this is a curriculum that you would build around these educational goals. And then you bring in the production and creatives to say, well, these are the stories that would help achieve that curricular goal. And so how do you tell that story? And then we include, of course, not only local advisors, but local creative talent. All the scripts are written in Arabic. They're written with local writers. The puppeteers are local. And they tell stories that mean something to them. They create stories that mean something to them. And so that is an important part of the approach. And then once it's created, we still bring back our researchers and say, well, what's working and what's not working? And then we adapt, and then we try again, and we approve this or we change that. And I think that's one of the beautiful things about Sesame's storytelling is that they really focus on the core needs of children with a lot of inputs from a lot of experts. And they focus also on simplifying very complicated stories. And in our stories, Basma is from the neighborhood and Jad is new to the neighborhood. And so they're getting to know each other. They come with different stories. And one of the more powerful stories is when the characters bring and show each other their favorite childhood toys when they were little, even though they're only 6 years old. And Jad cannot share his toy because he left it at home. He left it back at his old home. And so Basma then decides to be a helpful friend and make him a new drum that he can now use in his new home. And so they're the kinds of very simple but beautiful stories that Sesame is able to tell that connect with children's experiences.
That's great. That's a lovely story. And then Marianne, when you take this beautiful story with Sesame and Ahlan Simsim, and then you implement it and you work with the communities, what has been critical in the success of Ahlan Simsim and the way it was welcomed both by children and their caregivers? And what are you learning from the study that is currently underway? You mentioned you have an RCT and that you are really exploring more in depth what's happening on the ground.
Yeah. Well, I mean, I think critical to the success of Ahlan Simsim has been what we were talking about earlier, which is really the partner forward approach, I would say, both the people that are here, but also all of the other people that are connected to the project and how that, influences the way that we approach content and other things. I think in terms of just complementing what Renee was saying around the amazing content that Sesame develops on the mass media side, what we do then in region is we take those assets and we combine them with things that like curricular content that can be implemented on the ground, sometimes co-developed with partners such as government or local actors. And what's really been critical in the success of those pieces of content has been feedback, both from facilitators, but also the community. So I would say, similar to what Renee was saying, that iterative process, both more rigorous, which I'll talk about in a minute, but also formative M&E data and collecting information from the users themselves has really been important, both in driving what we prioritize and what sometimes we deprioritize when things don't work, and how we create new things. So we have a module for caregivers, and the entirety of that curriculum, which is something that we developed during COVID, was driven by caregiver feedback on where they felt like there were gaps in what they wanted to be able to learn in order to better support their children. So one of the themes that came up was positive discipline in the region. So we have a module on that. So it's really been that again, I would still call it a partnership approach. I mean, caregivers on the ground are some of our most important partners that we work with. So I think it really all links back to that. In terms of the research, we do have our research partner, New York University, and a very exciting research agenda. And the first study is a randomized controlled trial of a program that we're implementing in Jordan. It's for caregivers and families who have children under the age of 3. It's called Reach Up and Learn. Another thing that we had to adapt during COVID was the approach to that research. So this is a program that happens over a period of 6 months, and it's really focused on that critical developmental phase of a child. And in Jordan, we're implementing that in collaboration with our health colleagues. We don't have specific learnings yet. We've just done baseline, but we do have some interesting process learnings, and we've done a lot of iterations on the way that we collect data and how we can collect data that's focused on child outcomes, even remotely. So we're piloting some of that now in other countries like Lebanon, where we have videos, and we're going to be implementing some of those more outcome-focused data collection methodologies like IDELA for anybody who's in the education world, so that we can really start to refine the way that we look at data collection so that we can understand the outcomes, even if we can't be there in person. So that's been another thing that's been super exciting. We will definitely share once we have inline results and can speak about causality, but it's still a little bit early for that.
Thank you. We'll definitely stay posted to reading about the findings. My next question is about community resilience. And I know even from my previous work, both working with children with cancer around the world, I saw firsthand the resilience of children, their families, their caregivers, among different countries, cultures, systems, and learning a lot from them. So I wanted to ask you, what have you learned from working with children and their resilience to go through a disaster or crisis? And what can we in the humanitarian community learn from children? Maybe Renee, you can start, and then we can ask Marianne.
Well, as you mentioned, children are instinctively and naturally resilient. They learn and adapt. And our role is to create safe spaces for them to be able to practice those skills and to give them support and to give them opportunities to practice those skills. And so in terms of the approach that we've taken is to strengthen those skills through the storytelling, through the materials that we generate, support the parents and how they support their children, as Marianne mentioned before, their stress levels, managing their own stress levels, and then that helps them be better learning support for their kids, especially now that the burden of learning has come to parents quite more significantly than before because of restrictions that had closed schools and other educational centers.
Maybe just to add, I mean, I think we can all as individuals and as a community learn from every child we come into contact with. Just children will create joy in their environment in most places. And that's what we see with a program like Reach Up, or with some of these programs that now we have to implement remotely because of COVID in many places. Sometimes it just takes a very small thing to inject either a game or something to do in terms of play, or a mechanism to connect with your child. And the hope is that learning is mutual, that caregivers are both teaching their children, but also learning from their children. Social emotional learning, I think we can all also increase our emotional intelligence. And so I think there's a lot that we can take from this program, at least that I've also taken personally. And I think as a sector, one of the things that I think early childhood development tells the story of very successfully is that, there is no such thing as a sector to a child, right? Like, a child exists as a child in a family, and whether they're going to the doctor or going to school, like, they're existing in their world. And the more that we can streamline and work together across different sectors or communities, the more that we're able to put the child at the center of things. And I think as a sector, we're still very siloed. Even if you look at SDGs and different ways that we approach, measuring our own success, I think there's a lot that early childhood development has done well. There's the nurturing care framework, which really is a very easily digestible way to look at how you can support a child holistically. So I think there are a number of takeaways that we could glean from this work as a sector as well.
And that's a great point. We are also, I would say, suffering from the siloed approach, being part of a large academic bureaucratic system. So I totally understand what you mean. But looking at the future now, what will be some of the big trends driving humanitarian crisis and how they impact early childhood development? And for example, besides conflict, what do you predict or foresee being the force behind refugee or internally displaced population? Climate change, technology, others? How will the future change in your field?
I can go first on this.
Yes, sure. Yes.
I think climate will be a big one, but I think when we really take a step back and look at things from the macro, it's really hard to disentangle how climate impacts economy, which impacts poverty levels, which impacts education. So I think sometimes it's hard to find the root of the root. But if you take an example like Iraq, in the south of Iraq, the climate is a major issue. And the way that manifests in the country is there's a lot of urban migration. The country that's already quite oil dependent and not as focused on agriculture has to be even more oil dependent because climate change is basically making agricultural and that opportunity as an economy very difficult. And so it kind of all one leads to another, which then leads to higher levels of poverty, which then really affects the youth. So I would say climate is one thing connected to many other things that we're going to continue to see moving forward. But one, I think that's important for all of us to think about, what our stake is in that.
And Renee, for you?
Well, to follow on that, I think that the ongoing conflict, we need to remember that unfortunately the Syrian conflict is now it's in 11th year, which is tragedy in its own. It means that families have not been able to be where they wanted to be. It means they've left other family members, and so that is the geopolitical issues around conflict are continuing to affect families in this geography and in other geographies as well. Internal conflict, internal political strife, the instability of governance, I think is a challenge for families, and therefore what they're able to offer their children, especially in early learning. And then of course, we briefly mentioned the pandemic, but the pandemic has had a significant impact on economies. And on the household economy and on societal economies. And that is contributing to choices that families are making around what they prioritize, what they spend money on. what they're able to spend money on. If the cost of fuel is prohibitive, then I just can't bring my child, even if I want to bring my child to the learning center. So that's why a lot of the learning that we're doing, just because we all had to, about remote learning, is one of the things that we're eager to share what's working and what's not, honestly, about the efforts that we're doing. We have a wonderful resource, which is our digital content, like an Ahlan show, be accessed remotely, but it is also complemented with guidance for parents. So those are some of the learnings that we are in the process of experiencing, and we're trying to capture and document, and we'll be sharing over the next couple of years.
Great. And Kristen, from the foundation perspective, what are the big challenges in the next 5-10 years, or priorities for you?
So I'm not sure I can add anything more to what Renee and Marianne said. I mean, I think those are huge issues, right? Global health crises, climate crises, agriculture crises. I think all of these are going to continue to be problematic. And I think, foundations and the donor sector is going to continue probably to bifurcate and choose which problems they want to double down on in terms of solving these problems. What I would like to see, though, in the future, it goes back to what Marianne was talking about earlier, which is we have to move away from these silos, and we have to stop pretending like these crises are going to be quick crises that are over. As Renee said, we are in the 11th year now of the Syrian crisis. We have a crisis in Bangladesh. We have a crisis going on in Venezuela. These are not short-term fixes, especially with governments, fragile states. And so thinking about how we can work more collaboratively, ensure that young children in particular, are supported from the beginning of a crisis all the way through and not forgotten about because they're young, is really critical, because that is going to be the next generation. So if those children are not supported now, they're not going to be there for the future generation and to help build back their countries or to become productive members of society. And so I think it's really critical that we as funders start finding ways to support de-siloing our work. I think one of the important things that Sesame has done and IRC has done is that, with funding from MacArthur, really built on advocacy and scaling work and partnerships at the government level, at the UN level, thinking about ways to break down those silos and make sure that small children are incorporated across these different clusters of humanitarian aid response. And I think that's another place where donors can really think about how they can be effective, right? It's not just about funding a program on the ground, but also thinking about what does it take to really change a sector, and how can we support that and build that into our funding models. So those are the things I hope to see, as opposed to, as we move forward and thinking about the various crises that I think we're all going to be facing as a global community.
Thank you. And I will follow up with one of the questions from the audience that relates to what Kristen mentioned now and in the beginning of the webinar about how little of the funding actually goes to children and then to early childhood development. Somebody's asking why there has been so little attention to children and early childhood development at a global scale. Why this is not prioritized enough?
So I think I can give you an answer. I'll pose a hypothetical, and Renee and Marianne can disagree. I think the challenge with the 0 to 6-year-old range of children is that they're not in school. They are not at a place. So it is much easier for organizations and nonprofits and funders to identify a place where funding can go, a school, a health center, health community, et cetera. And it's much more difficult when you get down to the family level, right? We're really talking about supporting families with children who are 0 to 6 years old. And families are not necessarily always in one place. They're spread out. And I think that is what is a challenge for a lot of donors, is it becomes more complicated to measure success, how impactful your funding is, all of those pieces, where if you're funding a primary education program or a secondary education program or tertiary education program, you can really define, very easier to define and easier in theory to collect metrics to show impact. And I think when you get to that 0 to 6-year-old level, what we've just seen, even though there are a lot of measures that you can measure that show impact, whether it's stunting and nutrition and developmental levels, it just is more complicated because children tend to be spread out, families are spread out. So that would be my hypothesis as why there's been less funding to this particular area. It's just been a gap.
Yeah, I mean, yeah, I would agree. I think also, and you were speaking to this a bit, Kristen. So one, there's been a lot of progress since we started. I mean, even in terms of legislative progress in the US, the Thrive Act passed this year in January, which is a super exciting development on the side of the US, which is a legislation that will hold US missions and the US government accountable for doing early childhood development better across sectors, which is super exciting. But Sarah, actually, who's been messaging on the chat, I think also got it as well. In crisis and conflict settings, I think the default is to prioritize things that are framed traditionally as basic needs, right? I don't know why education has not been framed or early learning has not been framed as a basic need, but the default is, and in many places, it makes a lot of sense, right? Like, let's get in with WASH, let's get in with health, because those are the things that can also have a domino effect very quickly in places where, you know, you might be looking at a cholera outbreak, or, you know, there's an emerging health crisis. Like, these are the things that are considered the first level priorities. And what we've been trying to say as a partnership is exactly what Kristen was saying earlier. If we're not prioritizing children in the early years, that is going to have a domino effect for years to come. And so, at least for IRC and for Sesame and for this partnership, we would say that early learning is a basic need and it should be included in that first level response always. But I think there has been a traditional approach, especially with humanitarian donors, not development, to really go in first with short-term grants that are looking at how can we address the most perceived acute piece of what's going on now immediately. And early learning and under fives has just not always been first up for that.
Mm-hmm. And we have a couple of questions that are about the same topic, about mental health education for children. So what is being done around that? Maybe if there are stories particularly addressing skills to cope with mental health. Maybe Renee, you can tell us more about what Basma and Jad are doing about this.
Yes, absolutely. So as I mentioned, the focus, but not exclusively, of the content that we're creating as Ahlan, Simsim, and the show is on social emotional learning. And those are the skills that one uses to manage your own mental health and to help others and to support others. So, for example, Basma in one of the storylines expresses that she is afraid of the dark. And there are the grown-ups in her life, the characters in the story, help her learn and practice belly breathing, how to control your emotion or manage your emotion, to say, okay, first of all, I think I know what I'm feeling now, it's fear. And then to belly breathe, to breathe in for 3 seconds and hold it. Everybody practice with me. And then breathe out for 3 seconds. And just pause and understand what you're feeling, and then other coping strategies that are part of the storyline, so that Basma, Jad, and others characters model that practice, and then children are practicing. And one of our research studies as well, where we get feedback from families, is how much parents have appreciated those very simple techniques. And to Marianne's earlier point, that they report that they also have appreciated those learning techniques, there's coping strategies themselves to manage their own emotions as they support their children.
Thank you. Another question was whether there are any plans to scale to other countries, whether in the Gulf or other income level countries where they receive a high number of refugees.
So Marianne or me?
I can go for, I mean, I think for one thing that's beautiful about Ahlan Simsim is that when you think about what we're creating, it's de facto scaled, because the show is available anywhere you have Pan-Arab. And in the partnership, we're also creating other digital assets that will be very easily scalable when they're ready, after they've been tested. But little, things like sharing tips on WhatsApp for caregivers that have children under the age of 8, 6. So WhatsApp business model where you can say, I have a 6-year-old, can I have an activity for my 6-year-old? And the chatbot gives you an activity. So there are certain pieces of the project that I would say we don't need to wait for a plan. It's already kind of baked into what we're doing. In other places, yes, we're hoping to scale and to grow. That's our ambition because we believe in what we're doing. Where is still TBD. But my perspective has always been, why not if there's a need? But I don't know, Renee, if you have other.
Yeah, absolutely. I mean, while the focus of this program was children affected by crisis and conflict, it's not just children in MENA. With IRC, we've collaborated on another program funded by the Lego Foundation for support to the Rohingya refugee population in Bangladesh. And we're looking for other opportunities to collaborate as partners, but also to continue to support children affected by vulnerability, by different challenges that they're experiencing, not only conflict and crisis. So that's part of what we're trying to achieve both within the Middle East, North Africa region, but also as a partnership beyond that.
And I would just add too, I think the team has been really smart in thinking about what kind of messages are cross-cutting messages, right? So not everything is so specifically tailored. It's tailored to the Middle East, but there are messages about what it means to welcome new people to your community and all of those pieces that those transcend location and can be easily readapted for different contexts. And I think that was another piece of what was exciting about this potential work with partnership with Ahlan or with Sesame and IRC, was that it was an ability for us to test, could this be a model for scaling to other places where there would be a crisis, but to Marianne's point, doing it from the beginning of a crisis as opposed to waiting until you're 8 years into a crisis, so to speak, before you're thinking about focusing on children. So that was baked into the process with this team, I think, from the very beginning.
And I'll just jump in on that. While Basma and Jad were created for the Middle East and they have names from the region, they are also important characters that we've used in other content that we're creating for other geographies. Some of this content was applicable to the Rohingya context, and Basma and Jad also participate in a problem-solving segment in the South Africa Sesame show, Takalani Sesame, and those problem-solving segments are also going to be part of the Ahlan Simsim broadcast and YouTube. Everything's of course available on YouTube as well in MENA. So there's a lot of learning that we're doing across our work, and that these messages of social emotional learning, the coping skills are applicable in different communities. But we always do tests to make sure that they are acceptable in these different communities, but they are applicable.
Thank you. And Renee, actually, this answers one of the other questions about the lessons that can be transferred to other settings and in other work that you're doing in other geographic areas, that still the message is the same. And we do have time maybe for one more question. So somebody is asking about that in MENA and other regions, there might be lack of access to formal certified education and how it affects many displaced kids, and whether you think that the success of Ahlan Simsim can be leveraged to create pathways to formal education, whether it's pre-primary or primary for displaced children.
Yes, I mean, in a couple of different ways. I'll speak specifically to MENA, but what we've been doing here is thinking about, one, the program and the types of things that we're doing in collaboration, in particular right now in Jordan, Lebanon, and Iraq with government. So we've created a couple of programs that are focused on how to prepare children for first grade. So this is, I think, capturing a little bit of what you're saying. it allows for children to be entering first grade more prepared. So in Jordan, this program is implemented in collaboration with the Ministry of Education. There's a module that's pre-first grade, and then there's now a module that's during the first couple of weeks of first grade. So readiness and remedial. But we also really are thinking about this project from the level of policy as well, and how we can be advocating for, in the countries where we're working and also globally in collaboration with donors, with governments, with multilaterals, that funding is allocated for early learning to be a priority, because we know that preschool is beneficial for children. So a readiness program is great in places where, as our colleague that asked this question was saying, there maybe are access issues or funding issues on the part of the government, but it's not a solution for preschool. Like, we would still be looking at policy side solutions that are hopefully making preschool more and more accessible to children in the countries where we're working. And that example holds true for things that would be happening in collaboration with the Ministry of Health as well, access to prenatal care, those sorts of things that also contribute, that are super important for early childhood development. So yes, the short answer is yes. The more complicated answer is it depends on context, but yes, that's our goal.
Any additions? Okay, then. So it seems we are reaching the end of our time. So this has been a fascinating conversation and very engaging from the audience. I certainly learned a lot, and I got more excited about the work you're all doing. I would like to extend my gratitude to the speakers for their time and sharing their experiences with us. We deeply appreciate hosting you virtually at the Harvard Humanitarian Initiative webinar series. And I would like to thank the audience for joining us and invite them to visit our website to learn more about HHI's work and subscribe to our mailing list to receive more news about new programs, webinars. So thank you all. Thank you again for joining us, and goodbye.
Thank you.